Hi, I'm Dr. Megan Kelly. I'm a qualified veterinary surgeon and a certified canine rehabilitation practitioner. 10 years ago, I opened up a veterinary rehabilitation practice in Cape Town, and since then I have been treating thousands of patients, whether they be for arthritic problems, they might be paralyzed due to a neurological problem, and even post-operative cases after hip surgeries or knee surgeries, for example. I can clearly remember the day that I decided that I needed to study further, when I needed to find a way to treat patients that have muscle and joint problems in a more natural way. I was working in the UK in a practice there, and there was a dog called Toby. He was a golden retriever, and he was in the hospital, and he had been there for a few days, and he was on drips, and he was really in a critical state, and he was suffering from bleeding gastric ulcers. And these were as a result of him being on anti-inflammatories for quite a long period of time for his arthritis. And Toby had come in and he'd been diagnosed with arthritis and prescribed 30 days worth of anti-inflammatories, and the client had just continued to get repeat prescriptions. But after about 10 months or so, he started to show some symptoms of vomiting, and they noticed these little sort of black granules in his vomit, and these are actually digested blood. And things sort of progressed very quickly over the next few days, and he came in a critical state, really vomiting badly, dehydrated, with electrolyte disturbances and slightly anemic. And I looked at Toby and I thought, here is this dog that we were originally trying to help to manage his pain and inflammation because of his arthritis, and we have given him a medication, and this has actually caused him more harm, and we actually have risked this dog's life. And when I was looking at him, I thought, well, there must be another way. There must be another way that we can help manage their pain and improve their mobility, these arthritic pets such as Toby. And that was the reason that I decided to go and study further, and I studied canine rehabilitation in the United States at the University of Tennessee, and started to learn about strengthening different muscles and how certain muscle groups are really important to help stabilize joints. In arthritis, we have got unstable joints, and what tends to happen is, because these dogs are not walking in the right way, they tend to be compensating, not using their bodies correctly. These muscles that are supposed to be supporting the joints waste away. And so what I have developed over these years is a strengthening program for these pets with arthritis, and it basically is a series of exercises, and this goes over a 12-week period, and these exercises help to target the specific muscles that help to support joints. And by strengthening these muscles, we can help to improve stability in these joints and minimize the pain that your pet, if it has arthritis, would be having. The more stable the joints, the less pain, the less painkillers and anti-inflammatories, and the less likely they'll get side effects such as the golden retriever Toby. So my natural way of managing pets with arthritis is to help with muscle strength and to target the specific muscles that support the joints. So in my 12-week strengthening program, every week you'll be sent a video explaining what exercises you'll be doing in that particular week, as well as an exercise program which you'll be able to download. Each week the exercises will become more and more difficult, and we'll be challenging things like muscle strength, challenging balance, as well as core and your pet's joint proprioception, and that is their awareness of where their joints and their limbs are in space. This is an example of the type of exercises that I'll be giving you. These are exercises that you can do at home with your pet, as well as on their walks, and it's really important that we incorporate this into your everyday life, so that it is something that's sustainable and something that you can continue on for the rest of your pet's life. This is the hip bounces exercise. With either hand on either side of the hip, you're going to gently bounce your pet down so that they're taking weight on both their hind legs. So why not take control of your pet's health? Get the 12-week strengthening program for arthritic pets now. I'm Dr. Megan Kelly. See you later.